The ethical problem of this case involves whether Mr. Benson has the ability to refuse transportation to hospital for further medical treatment. The question must be asked, legally and ethically, is Mr. Benson fit to make this decision? According to relevant legal frameworks and in relation to ethical principles, yes, Mr. Benson is entitled to make this decision. The facts of this case, relevant ethical principles, and the professional code of conduct will be discussed in support of Mr. Benson's decision. The alternate course of action will also be considered, along with the relevant legal regulations for this case. The paramedics assess the patient using a valid refusal of healthcare. This includes using the Verker assessment. Verker includes voluntary, which gives the patient a free choice of coercion or influence from another person. As Mr. Benson was home alone, his decision to refuse care wasn't influenced. Informing the patient so that they know the risks of rejecting treatment, the paramedics informed Mr. Benson he was having an acute myocardial infarction and the risks if left untreated. Making sure the refusal is relevant to the treatment that has been recommended. Mr. Benson accepted the immediate care of oxygen and GTN, but refused transport to hospital. Assessing that the patient has the capacity to understand the consequences of the decision, the paramedics gave detailed information regarding Mr. Benson's situation, giving advice that is deemed valid to the patient, providing advice or recommendations to promote comfort and safety if the patient remains home. As Mr. Benson remained home, the paramedics gave detailed information on what could happen, what he should do, and that he will follow up with his GP. Bioethics involved the reflection of ethical issues in healthcare, health science, and health policy, incorporating the four main principles: autonomy, beneficence, non-maleficence, and justice. In relation to autonomy, Jenny should have respected Mr. Benson's decision to refuse further treatment, as it was what he wanted. Justice relates to respecting the patient's right to decide their own healthcare decisions, which Jenny failed to do. For this case, the principles of beneficence and non-maleficence are not as relevant, however they are still present. Non-maleficence focuses on the prevention of harm, in which Jenny's primary intention, while beneficence regards advocating for your patient's best interest, evident in paramedic actions. A person has the right to make decisions about their health care, including accepting or rejecting recommendations by their health provider. Within the QAS CPM, it states that every adult person has the right to make decisions regarding their health care. The QAS supports the Australian Charter of Healthcare Rights, which describes the rights of patients using the healthcare system. The Charter informs paramedics to ensure safe and high-quality service and the best possible outcome for patients. Paramedics respected the code of conduct when dealing with Mr. Benson's refusal of care. Mr. Benson was of sound mind, therefore, he was about to make a valid refusal of transport. To focus only on laws and theories that support the patient's decision to refuse transportation and ignore those that don't is not a sound ethical decision-making. Rather, an argument should also be made for an alternate course of action, which in this case would be that the patient's refusal is invalid and that the consent to transport is obtained from the health attorney. For refusal to be deemed valid, the decision must be voluntary, informed, and relevant, and the patient must have capacity. In this case, due to the trauma of recently losing his wife, it could be argued that the patient's capacity may not be sound, and he may not care about the gravity of the decision. Therefore, it may be an appropriate decision to allow for the health attorney to consent on his behalf. As a healthcare professional, there is a duty to supply the best healthcare possible. Therefore, a course of action should be chosen to lead to the best possible consequences. A paramedic influenced by consequentialist theories might be more likely to deem the patient's refusal as invalid if they thought there was a high likelihood of treatment or transport leading to better consequences. Legal regulations do not support Jenny taking control of Mr. Benson's treatment. Jenny is Mr. Benson's healthcare attorney, which does give her the right to make medical decisions for her father, although lawfully under the Powers of Attorney Act 1998 only if he has impaired mental capacity. The Ambulance Service Act 1991 coincides with this information as it outlines others can consent to disclosure of treatment only if the patient does not have mental capacity to consent. Mr. Benson can only be deemed to have impaired mental capacity if said so by a medical doctor. The attorney, Jenny, is not able to make these decisions unless this medical certificate has been made. As this was not done, according to the Criminal Code Act 1899, if the paramedics continued to follow Jenny's decision to treat, they could be liable and charged with assault. As well as this, Mr. Benson has taken steps to create an advanced health care directive, which stated that he did not want any life-sustaining measures taken. An AHD is an extension on a health attorney as per the Power of Attorney Act. Even though Jenny has a health attorney, in the hypothetical situation of Mr. Benson becoming mentally impaired, she would still legally be obligated to abide by the wishes outlined in this AHD. When it comes to Mr. Benson, he had the capacity to make his own decisions regarding treatment. While he did refuse transport, he did not refuse treatment on scene. In this situation, there is a health attorney who is advocating for transporting. However, unfortunately, as the patient had full capacity to refuse transport, the paramedics must respect the patient's decision. The paramedics acted correctly according to the law's ethics QAS protocol, listening to the patient and respecting their rights. The final decision, given the ethics, code of conduct and regulations regarding this case, Mr. Benson had full capacity to refuse transport.